That you can count on continues on News Channel 15's First News.
A 4-year-old boy was bitten by a rare and poisonous snake last weekend that sent him to the hospital for a couple days to recover.
Now questions are surfacing about this snake and just how common it is to this area. Joining us this morning is IPFW professor and expert on this type of snake that bit the boy, Dr. Bruce Kingsbury. Thanks for coming in this morning,
My
Bruce.
pleasure.
Let's talk about just what snake this is again and how we recognize it.
This was an Eastern Massasauga. It's the only rattlesnake and the only venomous snake that's in northern Indiana. And the image there shows you the blotched pattern that is typical of the species.
All right. Now, like you said, how common are these in Indiana? Are we going to run across these in northeast Indiana if we're going to the park every weekend?
Well, this snake is actually quite rare, particularly in Indiana. It's a federal candidate for listing as threatened, and it's state endangered in Indiana. It's only found in a few sites that are typically what I would call kind of or what many people would call swampy areas that have water, grasses, sedges, areas where a lot of people typically would not want to walk. And so the encounter rate between these snakes and people is actually quite low.
So is that kind of when they wouldn't necessarily go after a human to bite one of us? It's if we kind of encroach on their space?
I think that's fair to say. A lot of people are worried about them being aggressive, but this snake and also other snakes in the state that are venomous are not aggressive. They tend actually to try really hard to avoid people, and there even have been studies that show that most of the time when they're stepped on, they don't do anything. They're very shy and they don't want any trouble.
So a lot of people worrying, you know, after this incident happened last week, and a lot of people worrying, you know, if my kid steps on this or if I step on this, what do I do when this happens? What do people do?
Well, if someone were to be bitten, which would really be quite unusual, the important thing, first of all, is to stay calm, because we don't want somebody to cause more problems by accelerating their heart rate, running around, that sort of thing. And other than just staying calm, the other thing is just to get someone to help you, take you to a medical facility. Now, the bite is serious, certainly as we see in this particular case. However, no mortalities, no deaths have occurred from this snake for nearly 100 years. And as far as snake bites are concerned, this species is not particularly dangerous compared to some other ones.
Clearly, taking care of your own health is the primary concern should you be bitten, but what about the snake? I mean, is that something that people need to capture and report, or try to get in an area so someone can come and capture it?
Well, I can understand that people would be concerned and want to kill the snake, that sort of thing. The truth is the snake's probably about as freaked out as anybody. It thinks somebody's trying to eat it, and it's very likely that people would not see the snake again. So in terms of the risk of the snake itself, I would say that it's relatively low, particularly for this kind of snake. Taking pictures or something like that would be perhaps beneficial to figuring out what to do. But since this is the only venomous snake that's within over 100 miles of here, and since they're so very rare, any encounter in a natural situation anywhere in northern Indiana would be the Massasauga.
All right, Bruce. Well, thank you so much for coming on First News and joining us this morning.
Sure thing.
And